7 Common signs and symptoms of folate deficiency. And how to reverse it.
What is folate, or folate corrosive? Healthline clarifies that it is a kind of B vitamin, which encourages our bodies to make and repair DNA, and to create red platelets. Folate is water dissolvable, so it can't be put away in our body's long haul. We just remove overabundant sums in our pee. This implies we have to continually recharge our supply of folate, or we can wind up noticeably insufficient and simply an issue of weeks. The primary purpose behind folate inadequacies is an absence of specific nourishments in the eating regimen. Nonetheless, folate lacks can likewise be caused by certain gastrointestinal ailments, like celiac or Crohn's disease, or certain hereditary conditions, and it can be caused by over-the-top liquor admission, or specific prescriptions. Side effects of folate inadequacy for the most part fall under 2 classifications: general folate insufficiency indications, and manifestations identified with folate lack frailty. We've recorded the key side effects to pay special mind to beneath. 1. Mouth bruises or a swollen tongue. E-medicine clarifies that this side effect may happen before sickliness has set in. The tongue may look burly, red or sparkling, more often than not around the edges and tip regardless. Oral injuries can happen before and all through the time of frailty. 2. Reduced feeling of taste. NetDoctor clarifies that you may experience difficulty tasting your nourishment, notwithstanding the mouth injuries. 3. Gastrointestinal issues. Paleness frequently carries with it gut issues, however before that sets in you may encounter acid reflux and loose bowels. 4. Persistent weariness, shortcoming, and fair skin. WebMD clarifies that our bodies require red platelets to bear oxygen our bodies, and to our muscle tissue. Folate is in charge of making the red platelets, so when we are lacking in folate then we basically don't have enough red platelets to keep up our typical physical movement. This is called folate lack pallor. 5. Shortness of breath, or unsteadiness. NetDoctor clarifies that this side effect, alongside blacking out, is normal, and that you likewise may have an expanded consciousness of your pulse with a few palpitations discernible. 6. Trouble concentrating. You may likewise feel discombobulated or be progressively absent-minded, as per WebMD. Touchiness is likewise a typical side effect. 7. Body torments. At the point when the paleness is extreme it can bring about trunk torment, leg torments and migraines, as per NetDoctor. Fortunately folate lack can be settled as fast as it can set in, and the simplest path is through your eating regimen. Take a stab at eating bunches of dull green veggies like broccoli, Brussels sprouts and asparagus, and also citrus foods grown from the ground breakfast grains. You may have heard that folate is indispensable for pregnant ladies, and that is on account of it aids in the advancement of a solid spinal line when the baby is exceptionally youthful. In the event that you are pregnant, or wanting to end up noticeably pregnant, you ought to consider a folate corrosive supplement. How to prevent folate deficiency. Folate is largely found in plant foods, so the best way to get adequate folate and prevent folate deficiency is to eat 5 or more servings of whole foods, like fruits and vegetables daily. Green vegetables, nutritious Brussels sprouts, broccoli and peas, for example, especially all types of leafy greens, along with beans and citrus fruits are particularly important for preventing folate deficiency. Folate is also naturally found in some animal products, including liver and poultry. Generally speaking, it should be pretty easy to prevent folate deficiency by eating a well-balanced diet. But studies have shown that folate absorption varies widely from person to person. There are several factors that influence how much folate someone can absorb from the foods they eat, including their levels of zinc and health of their kidneys, liver and gut. The total body content of folate is estimated to be 10 to 30 milligrams, about half of which is stored in the liver. The remainder is found in the blood and body tissues. To test for folate deficiency, a doctor might conduct a serum folate concentration test. A value above 3 nanograms indicates deficiency. However, a more reliable approach is testing erythrocyte folate concentrations, which provides a longer-term measure of folate intakes, and is a better indicator of stored folate within tissues.